Hi, ladies. Welcome to a very special conversation tonight. Still letting some people join in and get into the room. I see Natasha here. I see Tanya here. And this conversation is going to be a very heartfelt one because the Lady the FUp community, we work really hard, but there's a very special group of individuals that are fucking warriors that unfortunately have to or have had to go through a battle with their body and with their health. And in a community where we do everything to take care of ourselves, unfortunately, there's only so much that we have in our own control. So just looking at the call here, we have Natasha and we have Natalie and we have Tanya. This is not just an event for women who have lived the experience. This is for everyone to be inspired by, to hear the stories, because even if you haven't personally experienced it, I'm sure that this is something that you have known of someone in your life. So I'm not going to talk too much here. I know Janet we have on here because she has gone through similar experiences, not personally, but with her mother. And Janet, before she came into this community and stepped in as a coach, she was heavily involved in the pharmaceutical industry. So Janet, would just love for you to share a little bit of your personal story.
Thank you so much, Lexi. And it is indeed a privilege to be on this call with these wonderful women tonight. And thank you very much for giving me the opportunity to speak. Um, I'm a nurse by background, first of all. Um, that profession really helped set me up, I think, for my role as a coach. And also, I did a podcast with Rima, and I mentioned to her that I feel like that role of being a nurse set me up so well for the one mission in my life, which was to help my mom when she was diagnosed with cancer. So my mom unfortunately passed away almost 18 months ago. And what I really saw during her cancer journey, she was diagnosed very late in her cancer. So her prognosis was very poor from the beginning. But I realized that one of the most impactful things from my mom that devastated her more than anything was her loss of mobility and function. And the skeletal muscle deterioration that happened to her body was unexpected and so rapid. And it wasn't a focus of her care to really focus on getting her moving and trying to protect as much muscle as could be protected to allow her to have a better quality during those final days. So this is something that, the whole aspect of the role of resistance training and the role of nutrition needs to be is so important for women with cancer, for men and women with cancer. And it's really interesting because just 2 years ago, there's a group out of the US. It's called the American Society of Clinical Oncology, and it's um, a world-renowned expert group of oncologists who make treatment recommendations and they design protocols. And for the first time ever in 2022, they actually made a recommendation for women undergoing active treatment. They should be doing resistance training. And so I have a few of those highlights here that we can talk as we go through the conversation. But I just thought, wow, it's really great that it's being acknowledged and recognized. It doesn't mean our system has people in place to, like the healthcare system, say, okay, you need to do this much resistance training, which is why we need to be so proactive with our own health and care here, use the knowledge and resources we have, and try to, um, you know, find groups like Lady the FUp to help support that aspect of our journeys.
Beautiful share. Now, Deborah, I know you mentioned that your client Renee would be joining us, and I just saw that she hopped on. So welcome, Renee. Deb, I would love for you to share a little bit of your insights as to how you've helped Renee these past few months with focusing on what she has control over while she is actively undergoing treatment. And then Renee, if you're comfortable to turn off or take yourself off mute and turn on your video and join in on the conversation, I would absolutely invite you to.
Thank you, Lexi. Well, when Renee and I are coming up to our 1 year anniversary, and like any woman that reaches out to Lady the F Up, her goals were, I want to build muscle and drop body fat. And there was not, but I don't think I can because I'm currently in treatment. It was just, this is what's happening in my life. This is what I've been dealing with. This is what I'm going through. And I need you to help me go from here to here. And it was, it was like, and I don't mean to minimize, it was like cancer wasn't even going to be discussed. It was like, this is what I deal with, but it's not who I am. It doesn't hold me back. And I got a very strong sense, do not belittle me with the wrong type of empathy. Like don't hold back. So I've never held back. I have pushed her. Her transformation has been phenomenal. Just to give you some insight, she is eating like 700 calories a day more. Like she's close to 1,800 calories. She's tiny. She's lost a lot of body fat. She has the best booty, a six pack, beautiful arms. And honestly, if you didn't know what I know, you would never, ever think that this person has down days because Renee is amazing. Like she never misses a check-in. She is consistent to a fault where I say, maybe show yourself some grace today. It's okay. She's a cheerleader for other women and has made me feel very special, which is not her role, by telling me that I am a very important person in her journey. And that has just, I mean, it's always a pleasure and I'm always grateful to help anybody get to their goals, but then to have somebody going through extraordinary challenges, and I'm not going to say obstacles, but they're challenges. We all have challenges and she's crushing them. Uh, I feel blessed. So it's your turn, Renee.
Oh no, I don't know what I did. I am not tech savvy.
You're good.
Oh.
See you.
Can you hear me?
Yes.
You can hear me. Oh, okay. Thank you, Deborah. Um, yeah, you have summarized very well. I think I was actually diagnosed September of 2022, I think. Is it 2022, Jeff, or 2023? I'm cloudy at night, so I do apologize. Um, no, 2023. Thank you. Took me a second. Um, so I have stage 3 melanoma with no primary site, which basically went in and attacked my lymph nodes and my glands. Um, Unfortunately, it had come back 3 times. So I underwent surgery in September, November, and December, um, removing lymph nodes and glands and all that fun stuff. So I went from like 0 to 100 basically, because the first tumor I found, they weren't sure what it was, but it needed to be removed. And I went right from stage 0 to 3. So that was pretty tough. But I actually had known about Lady the Fuck Up and was interested in it. But then everything health wise happened. Um, and then I decided that my best weapon was to get myself in the best shape. And I've always worked out, but never properly, which I learned. I thought that I ate well. I maybe was eating 1,000 calories a day, maybe. I thought I ate enough protein. Definitely did not. um, but I wanted to utilize and figure out what my weapons were going to be because I have no choice in this disease, but the choices I put into my body and what I do with my body. So I wanted to obviously get the best resources so that I could be my strong self, and go through what I needed to go through. This program has been more than just teaching me how to use gym equipment and to eat properly and maintain a strong physique. It gave me purpose. It gave me more to focus on than cancer because cancer takes over every part of your life, whether you want it to or not. From the appointments to the treatment to the scans to the waiting to the constant appointments, it invades everything. So I wanted to have some sort of normalcy and having, a program to do, in a space where nobody knew I had cancer and I felt normal. Like, I didn't feel like a cancer patient. And the check-ins actually I look forward to, which sounds probably so strange, but it's like, again, purpose outside of this disease and, you know, being a mom with 4 adult kids and running a business and all of that. I wanted something for me and to give myself the best chance. And I knew that I needed a coach. And besides the educational factors, it's also the encouragement, and it's not from my oncologist. It's it's not from my friends or my family. It's from someone outside, which carries a different weight. So over this, it'll be almost a year. I completed 17 treatments, all through this every 3 weeks, along with some other not so fun things. But sometimes I had to be more flexible. I am kind of very routine and rigid, and sometimes I had to be more flexible. But I never let the cancer come in between what I was doing, and I feel nauseous. I have, no saliva in my mouth. I have no glands left. I struggle with having an appetite, especially after treatment. And there was weeks where I dropped a lot of weight, and it was because I couldn't keep anything in me. But with Deborah's guidance, I was able to keep coming back, and I didn't lose muscle mass. Like, I didn't want to lose muscle mass. That was one of my main goals. And I know it's, just a layer of protection against this disease. And so, yeah, that's basically my story. And I feel strong despite my challenges. I feel strong. I'm actually waiting on results on Monday again, and I don't know who's familiar with melanoma, but it's not a disease that there's a cure for. So my cancer will maybe what I aim for is called NED, so no evidence of disease, but I'll never be in remission or be cured. My chances are actually really high of it reoccurring. Um, but I plan on being the strongest and physically and mentally, like to get through it, because we all have shit in life, right? We all deal with different things, and I didn't want the disease to take everything. So yeah, I've had a lot of support from Deborah, and then I've met people at the gym, and they're also clients, which is a funny kind of thing, but um, it's given me a lot of purpose. So that's it.
Thank you, Renee.
Yes. And I'm pretty shy.
Yeah, I didn't want to say that because I didn't want to make you feel embarrassed, but I know you're shy. And I know that when I've brought you to HQ to train, like you were a little bit shy, but you've always killed it. Like you know. What I wanted to ask you though is how do you navigate the gym knowing that people are dirty?
Yes.
Because, right? People are dirty and people come to the gym sick.
Yes.
Sneeze and they cough and they're like,
Yes.
and we know some people now that, or this young woman that who's just starting her cancer treatment, and the first thing a doctor said was, do
Mm-hmm.
not let your children with colds be around her. Like you cannot have that. How
Mm-hmm.
do you navigate that and not go insane?
Well, I go super early. Like I'm at the gym at 6. I'm really slow. I experience dizziness, but I take my time. So going early has been my key because I have gone later and it has been more full, which makes me my anxiety a little more. I double clean. I don't put my hands anywhere near my face. I don't care if there's a booger hanging out of my nose. I will not touch my face with my hands. I frequently go to the washroom and wash my hands, and I have hand sanitizer on me. So I have actually, knock on wood, not had a cold all year, and I've been at the gym 5 to 6 days a week. My team told me that I'm not allowed to work out. Like I should not be at the gym. The most I should be doing is walking. So, yeah.
Well, you're amazing.
Well, I don't know that I'm amazing, but I've got a strong mind.
Maybe that's what it is. You have a very strong mind, and you don't have an ounce of victim mindset whatsoever. And it's always a very good reminder to me when I feel a little bit sorry for myself. And because there's moments that I do feel a little bit sorry for myself for whatever
I
reason.
think we're all allowed to.
And I'm like, you know what? That you are always so positive and you're funny, and I enjoy our check-ins too because they're very interactive. They're good. They're great. And I enjoy
Yeah.
the little messages you'll send me when you crush something at the gym. So,
I think it's just important still to live. Like, yes, I have cancer. It's not going anywhere, but I still have to live. So whether you go to the grocery store, the gym, the bank, I don't care. You're touching your cell phone. Cross contamination and germs are everywhere.
mhm.
So, just be careful. And you know what? If I do see someone sick, I do say something
Good.
because, like you shouldn't be coughing and hacking and then lifting weights. No, that's not cool.
No.
Really, really appreciate you taking the time to be here, Renee. And I saw
Mm.
Natalie was writing down a whole bunch of stuff, and Tanya, you were nodding along and smiling. So, do you guys have anything that you want to share after hearing what Renee had to say?
I appreciate your journey and I appreciate your courage for coming out and speaking and being open about it. And I think that's one thing that us women, we don't come forward and speak enough about. And I'm new to the cancer I'm fresh. So my thing is one thing seeing with you, like you said, you can't get sick. And I'm like, you've altered like going to the gym first thing in the morning. And that's where you can minimize,
Mhm.
getting sick and everything. So that was like, wow, that's awesome. And just the fact that, going against whatever the team says, you're just like, they don't deal with the outcome you do. And, the best thing is that I've learned, and like you've said, you've just solidified and validated a lot of the things that have been going through my mind the last 6 weeks, in terms of just living and doing your normal. And yes, Lady the F Up is the absolute, I legitimately think that we need, especially in a time like this is definitely something that we need for us to feel normal.
Yeah. 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 My heart kind of did a double take when you said you were new, because I could flash back and remember all of those feelings. And as much as we're positive and as much as we're strong, it is the hardest news to take. And the fact that this disease shows, no consistency, there's, no same outcome for any person. Like I just feel for you, and I wish you the best, and I won't say anything cliche. But feel free to message me at any point. I think as women, and as survivors, we need to stick together and to support each other. And I've been there fresh in the journey, and it's scary and it's overwhelming. Listen to your heart, and your body best, and things get better. And then it's kind of like a wave of a journey, like you're up and down. And
Roller coaster.
you're right, it is. And I had to get a port put in my chest, and I was like, oh my God, Deborah. And I fought it for months, and all my veins were busted. And she's like, don't worry, we can work around it. And, I thought now my gym's gone, and that was my only place where my mind wasn't on cancer. And we did. So if, you take turns in your journey, know there are still solutions. There's still things you can do to feel good.
Absolutely. And I like that you said that you already had your diagnosis and then you started your journey. So I've started my journey 5 years ago. So I feel that my body, cancer sucks. It doesn't discriminate, but at the same time, I'm like, my body, like I did everything I could to prepare myself to actually, to mindset, everything. Being in the gym has prepared me to take this on and just
Oh, I think she froze.
deal with it. I froze. Sorry.
Now you're back.
Am I back now? I don't know where you guys left off. Sorry. I just said basically everything that I've done for the last 5 years, I feel has prepped me to take on this fight.
Natalie, I saw you writing down a whole bunch of stuff. Do you want to share?
Well, hi, everyone. Thank you, Renee and Tanya, for sharing your story. I was diagnosed in 2001. So what I wrote down was what kept coming up was identity. Because when you're a cancer patient, you have a whole new identity now as a patient. And your team, my doctor, I defied everything my doctor told me. They told me to stay and hide and don't talk to anyone. But I didn't listen to anything they said. But I live with constant anxiety of it returning. And I have a high risk of breast and lung cancer because of all the radiation I had and the chemo that I had. And now my mom just went through her breast cancer battle. So you're like, what I want to share is that you're new at this, but unfortunately, it's just you're always going to be dealing with it because you can't get over something like this. And it's about control. So we can control what we can, and diet and exercise and nutrition and mental wellness and all that is so powerful. That's why this is such a great thing that LadyTheFUp does, is having us talk and communicate and connecting, because then we don't feel so alone. And I was very isolated when I was sick. This is a long time ago. Cancer patients were treated a little bit differently. Now it's a bit different. But I was told to just stay in my house and just don't talk to anyone. And germs were a big thing. And that's where I got with eating. It was I was hiding. I was dealing with my emotions, my fear, anxiety with food, and I did that for 20 years. So now I'm starting to break that. And Mal, who's my coach, I don't see her here tonight, but for me, it's like, God bless her patience. Cause for me, it's the mental. I'm always struggling with the mental, because I do have PTSD from my diagnosis. And I've been dealing with something called survivor guilt. I don't know if any of the other ladies are dealing with it, but I feel like, all these people are sick and dying and I get a second chance. So why me? And so you deal with that. Not everyone that gets cancer deals with survivor guilt, but I did. So I had to go deeper. And where is that coming from? So it's been a physical journey, but it's also been a mental and an emotional one, which is why I really love this program, because you make that mind body connection. It's not just about, I think we talked about this a few weeks ago. It's not just looking good, and it's not about the vanity. It's about fixing the whole body, the whole, like mind and body, because without your mind, you're nothing. Um, and then germs, PTSD, anxiety. I'm a teacher. I'm surrounded by like sick, germy people all the time. So every time there's a sneeze, I'll panic and I'll run. I'm drinking hand sanitizer at this point sometimes because it's just ill. They're all a bit gross, but you have to live. You have to learn how to live with this new identity, and that's what I kept writing down. Like, see, identity. Like, what does it mean now to be a cancer survivor and still have a life? And it's a new kind of life now, because you look at the world in a whole different way than other people. And diet and nutrition is so important. Like, it's so important. It doesn't guarantee, but it does help when the shit hits the fan. So I saw my mother going through it now. My mom's not the healthiest, but I saw a lot of women there because it was a breast cancer clinic, and a lot of them are very unhealthy. And I wonder if maybe they had been a little bit proactive, or women, we're always taking care of everyone else. We let ourselves go. So maybe that's something we can also be talking about in the future. But cancer sucks. It doesn't go away. You're always going to be dealing with that in the back of your head. So I just want to, Renee and Tanya, like, I feel invigorated because sometimes even I get stuck. I'm like, so this was a good boost for me too. So thank you so much. You've inspired me. So I'm going to go hit the elliptical when I get off this call, just for fun, which is something I would have done. So thank you. Thank you for having me.
Natalie,
Yes.
I'm Deborah.
Hi, Deborah.
Hi. I'm one of the coaches, as you know. When you said that you had identified as a cancer patient and then a survivor, I think it's really important that that you don't lose that identity actually, and be very proud of it. And I'll tell you why. I've been very open about my past of being horrifically sexually abused as a child, uh, being in foster care, and overcoming that. And so when I would say I'm a survivor and I identify, people would say to me, "Oh, just put it aside, put it behind you. It's what happened to you. It's not who you are." And so I tried that for a while. And
Yeah.
then I realized that's not authentic. And that just
No.
makes everybody else uncomfortable if I tell you I was horrifically abused and, went through a 10-year court battle to put my abuser behind bars, and which is all true, and it made you feel uncomfortable, too bad, because that's part of me, and that's why I am where I am today.
Yeah.
So I didn't have to deal with a disease like you. I deal with PTSD as well.
Of course. Yeah. It's a trauma. Yeah.
It's a trauma, but I think it's I think it's okay that it's part of who you are. It's part of the fabric of who you are, and you're surviving. And you know what? I've been in group settings, and I have a lot of acquaintances that have taken their lives because of what we've all,
Yeah. Yeah. That's
right?
that's so true. And
And
last
I don't have
October,
survivor guilt though. I'm like,
well, not everyone does, but that's a different whole thing.
it is.
So last October, I was invited to speak at an event, and I got on stage in front of like 500 people because, for like you said, I didn't talk about this for 20 years. It was almost like, I don't know if it's the like an Italian culture, like a European thing, where you just put it behind you and move on.
Me
But
too.
you can't put it, yeah, you can't put it behind you because I'm traumatized. So how do I not talk about my trauma? So the silence actually feeds the trauma. So you have to talk about it. Not everyone does, but I needed to, and I was silenced. So 2 years ago, I finally wrote a book about it. Last October, I finally got on stage and talked about it, and that's why I wanted to join LadyTheFUp to get in shape and look good. But it wasn't even about that anymore. It was just about being on stage and comfortably telling my story. And I have reached out, or people have reached out to me, cancer, or like one lady was assaulted, like raped. And so it doesn't matter the trauma, but the fact that we're talking about it, I think, is, like you said, is important, because it is my identity. This is part of who I am. It doesn't define me, but
No.
it's a defining moment, and we have to honor it, because, like you said, then you're not authentic. And then my friend last year, a couple of years ago, he's the one that told me that I was being very selfish for not talking about it, because in the 20 years I could have helped so many people. He goes, imagine all the people you could have been helping and you didn't, because you're just scared of what people think, and you're scared to talk, and you don't like the way you look, and you're embarrassed to get up in front of people. Like, you're being so selfish. So like, why are you doing that? And so I never looked at it that way. And then, but getting up in front of people is hard, especially for someone like me. I don't like, I don't like, very hard on myself. I don't like the way I look. But you just have to get over that, because yes, it is like my identity. It's our identity. So not everybody wants to talk about it, but I feel like if you do, you shouldn't be forced to be silent, if that makes sense. But again, thank you for sharing that. That's, that's life, right? We all have something we're dealing with, and exercise,
100%.
movement, talking, is nutrition. It just helps us deal with it. It doesn't seem so heavy some days, because you go to the gym and you just, sometimes I'll cry by myself on the trail. I don't know if anyone else, I'll just start crying. It's just, it has to come out. So that's a great way to let it out sometimes on a treadmill.
I'd love to get Natasha's insight as well, because Natasha, from what I see, and I don't know you very well, but I know you've been a part of Lady the F Up for quite some time working with Magda. You openly speak about your story. And I know that you were featured in Inside Fitness last year as one of the inspirational women in the Hot and Fit. Yeah, so we'd just love to hear from you, Natasha.
All right. So I was diagnosed with tall cell papillary thyroid cancer. So when I got diagnosed, everyone was like, oh, it's the good cancer. And all cancer sucks. So it doesn't matter because you're all going through it. I do understand the survivor guilt, because I've had people very close to me, very younger than me, that have passed. So I've always asked myself why. But I feel like going through it, like I love hearing everyone's story, because we're all so different, and we've all lived different lives. And I think joining Lady the FF really helped me get through probably the toughest stage, and that was even after surgery. So I reached out to Mal first, because I grew up with her, so we're like besties from babies, and she connected me to Rima, and then Rima connected me with Magda, and I've worked with Magda now for years, and I'm like obsessed with the program and what it's done for me physically, mentally, emotionally. So my first surgery, I'll say, was February 2021. And the pathology came back, and so they removed half my thyroid and found out that it had spread to my lymph nodes. So I was on watch for about 2 years until it spread again to the other half of my thyroid, and then again to lymph nodes throughout my neck and close to my ear. So then I had surgery October 2023. So I am a year cancer-free. And it's been really hard, because I didn't do radiation or anything like that. But just dealing with hormone fluctuations and my emotions and all of that, plus my children, it was like very hard to stay strong. And I'm very strong, and I don't like to show it, but I do talk about it because it's true. Like, none of us talk about it enough. So I think that's why, like, even when I haven't been working with Megan and I've taken breaks, like, I do lean on her, and I do plug in and listen to the coaches and watch what they post, because it really does motivate you to, like, just not give up on yourself. And I know in most cases, like, we do fear, like, recurrence and things like that. And there is a chance it could come back for me too, because I chose not to do radiation. And again, even if I did do radiation, there was a high chance of recurrence because sister cancers. So these are just things I think mentally that we're all dealing with. And I think reaching out to each other really helps, and having this platform with all these amazing coaches with their stories and everything they've been through really helps kind of just fuel our fire and keeps us going. And I think that's like the bottom line, and having like our families and friends as support too. But most of the time it's, you know, a silent battle that we're not really expressing ourselves enough about it and not telling the world what we're dealing with. And I feel like I know, sharing my story on Instagram a few times that I have, I've had people reach out to me that also had to do things that I did, like biopsies and such. And they asked me about the process and what I dealt with. And I love like just seeing all of us kind of push through, like we can all get through it. We're all going to come out on the other side, and we're all so strong. So mentally, physically, emotionally, like we're strong, except for when I'm crying. Like I don't usually cry like this. So, but like it's really tough.
Crying is strength.
Oh yeah. I know I cry a lot though, but not in front of my children though, but like I do, I do cry, but it's true. So I understand, like, I understand, you know, all of us and all the little things that we're dealing with. It's a little thing in like the big scheme of life. Like there's so much going on for each of us, and it's obviously gonna make us stronger. Yeah. I don't know if there's any questions, but my story was like, I got into a car accident and found out, so I would have never known. So like things like this, I feel like that's why I believe so heavily in like guardian angels, because I feel like things happen in life for a reason. Like I don't know why me, but I think we all probably have thought that, like, why me? And it's just one of the bumps in the road. Yeah.
One thing I want to highlight about all of you is that you choose to be strong. Because there are some people who get this diagnosis and they tap out mentally. They're like, oh, what's the point? But you guys are like, no, we're going to show up. We're going to fight. We're going to prioritize our health and look forward to the gym and be open and share your stories. And that is just so incredible. And every single one of you is incredible. And we are so fortunate to have you as part of our community, because even those that are not part of this conversation right now, our future Lady the F Up clients, if anyone comes to us saying, hey, I just got this diagnosis, they're going to watch this conversation and know that they are not alone. So again, I just want to say thank you.
Thank you guys for putting this together. It's really.
Thank you. And I echo off of Deb, who, and even I'll even add yourself, Natasha, and even Natalie. I was diagnosed December 11th. My mom was diagnosed 5 days prior to me. So we're both doing this together, but at the same time, I did not know what any term meant. I didn't even know how to tell. I thought cancer, I was like, I'm positive, like it was a COVID episode. So because I'm the first one, I guess, even in my friend group and everything else, I did go out on Instagram because now I just want everyone to I have breast cancer. So I want everyone to go get their scans and be proactive. But if it wasn't for women like you, I lost a friend 3 days ago to cancer. She was 2 years younger than I was. And of just making sure that you stay on top of am I back now? Okay.
Yeah.
Staying on top of your scans and your biopsies and everything else. But I didn't understand when she said to me 3 weeks ago, get your CT scan, get all of these. I didn't know what any of this meant. I've now learned, because nothing's been done to me. I see my oncologist finally on Monday. I had my surgery 2 weeks ago, so I'm grieving the gym right now. So I've been grieving, going for my walks for now until I get the go ahead to just do something. But if it wasn't for women like you sharing, I wouldn't know. And I've learned more from other women than I have from any doctor in the last 3 weeks. So keep sharing your story. And like I said, I was ignorant to understanding what the journey was. So if you had told me back in November, you're a cancer survivor, I've been like, great. But now, let me tell you, there's a lot of strength that you find in that journey, and you're a powerhouse. And there's a lot of value, like how you give to us women is invaluable and it's priceless. So I just want to thank you guys for also sharing, because that's what I want to do. I want to do that throughout my journey, because I don't know what's ahead.
Janet, with your experience, can you share a little bit more about what the medical side of this is and what the common beliefs are around that? And as you mentioned, very recently, women should be resistance training, but what do physicians say compared to what should be done?
Yeah, one thing I also wanted to mention is like cancer is a diagnosis that, as horrific as it is no longer a death sentence. That's really important to keep in mind. People are living with cancer now. And a lot of the different guidelines recognize that with earlier recognition of disease, even depending on when you're diagnosed, if your cancer is more advanced, just the amazing innovations in oncology. It's unbelievable how much things have been revolutionized since I know your diagnosis in 2001. I believe it's Natalie, correct? Yeah. So advances are being made every single second, and it's really exciting. So for anyone on this journey, uh, hold on to that because things are happening all the time. I think that one thing I've heard throughout this call, and that certainly my mom experienced with her diagnosis, is just not a whole lot of what you can do in terms of being proactive with your health, and not in terms of just what you can't do. Don't do this. Go for a walk was like, that was the golden thing, just go for a walk. But it was, me saying, Mom, we need to do a little bit more than that to kind of get your strength up. But the medical community is now recognizing that women are living with this disease for a long period of time, like a chronic illness, and that it's therefore important. Often women are dying not from their cancer, but from other causes like cardiovascular morbidity, mortality. Some of the side effects of some of the medications can be difficult. So the more that can be done to, optimize your nutrition. And cancer does target muscle. Treatments target muscle, and cancer itself targets muscle. It like muscle protein synthesis is affected. There's a lot of breakdown of muscle for cancer to thrive, and so the more that you can do to optimize your protein intake and to do resistance training. And so the guidelines say something kind of conservative in my mind, but they say at least 2 to 3 times a week for resistance training. Obviously, with consideration of how you're feeling, so kind of auto regulating. If you have like your chemotherapy, for example, the first 3 days are probably you're feeling pretty crappy, and maybe depending on the treatment you're receiving, maybe by day 4, 5, 6, maybe consider then doing your training when you're feeling more energized. So these are just some thoughts to consider. And obviously the aerobic side of things, so doing not just walks, but it's perfectly fine to do things like cycling, swimming, those types of things to maintain your cardiovascular health are obviously still recommended. So I like that now oncologists are not just focused on like treating the disease, but also treating the person holistically, and recognizing they can't ignore the fact that you're still living and need to thrive. So I love that that's kind of a shift in the thinking about cancer. And I love the advances that are being made all the time. My mom's cancer that she died with, she was on an experimental drug in the end. She was put on it a bit too late, perhaps, to have had an effect. But since her death 18 months ago, that treatment is now like accelerated in terms of being used earlier in treatment for women. My mom had ovarian cancer presenting in her peritoneum. So she had a very kind of rare presentation, but now there's a treatment that is widely available for women just in 18 months. So I love these stories of hope that keep coming through.
I want to open the chat to any of our ladies who have been listening. Do you guys have any questions or comments? Feel free to type them in. My question to the four of you, Tanya, Natasha, Natalie, and Renee, what do you tell yourself on the hard days?
I'll go. I've had a lot of hard days the last couple of years, especially last couple of weeks watching my mom. You just have to, instead of ignoring it, like before when Deborah and I talked about it, like ignoring it or pretending it doesn't happen, or just or using food, for me, using food and alcohol to cope. Now I tell myself that it's going to be okay. You can't, like, just like sit with it. Like, don't, like, just sit with it. Like, let yourself feel it, and then do something that makes you happy, that makes you feel in control. And for working out, meditating, prayers, journaling. For me, it's been writing, talking to a friend, watching a stupid, silly movie, um, whatever. And I loved what Janet said. Sorry for your loss, Janet. But I like a lot of what you said. Is like, it's almost like you have to be your own doctor sometimes, and that's okay because everybody knows their own body. So, like I said, I defied everything my doctor told me, and I think that's maybe why I survived, because I listened to my body. So on the hard days, even though you still have them, you just got to push through and reach out now to someone. Now that we're all friends, right? We can all reach out to each other, and just like, don't ignore it. Like sit with it, and then you decide when you, like, that voice in your head. Like, sometimes she goes, and then you tell her to go away. That's what I do. I literally talk to the cancer demons, and she goes, and then I tell her to, like, fuck off and go, and then I go, like, I regroup. So you almost have to talk to, like, a person. Like, I imagine like a person, and I talk to it. And for the longest time, I used to have, the biggest tumor I had was in my chest because I had lymphoma, and my doctor said to me that it's a grapefruit. So I have pictures sometimes of grapefruits, and I'll put them on a wall, and I'll just hit it, because that's me. Like, even years later, I'm like, I'm hitting it to stay away from me. So whatever it is you got to do, just do it. And it's going to look different for everybody. There's no right or wrong way to do it, but just you know, you can do it, is my point, I guess, in my ramble.
I guess I'll go next. So on my hard days, and I have them, I really like taking a nice hot shower and just sitting with it. Like, I'll cry, I'll listen to music, I'll just sit with it. It doesn't happen often anymore, which I'm very thankful for. But every 3 months, when I have to go back and get a checkup, and I have to go see my doctor, that week is probably the roughest week. And then waiting for those results the week after, probably those are the weeks where I'm really sitting with it, and I'm like, my focus is off. And I know Magda has seen that. Like, I'll be like, I can't, I'm not good right now. I can't do all of this stuff. I can't work out. I can't do this. And I think that's where it becomes really hard. So you sit with it, you let the emotions flow. I usually spend a lot of time close to my babies when I'm feeling that. So I have like an 8-year-old and a 6-year-old, and yeah, they're just my safe space. I'm just cuddling them and just being so thankful that I'm, healthy and I'm okay for my kids. So that's what I do on the hard days.
I'll go next. I think on the hard days, I don't know. I just keep going. In my mind, I just feel like, like, you're not winning today, cancer. Like, I've been to the point where I get to my car and have to run back in my house and be sick, but I still am not willing to give up. Like, I don't know. I think I'm just crazy or thick-headed, and I know I'll feel better once I get there and start to do my program, but I'm not willing for this disease to take anything, I give it a minute and I throw water on my face and say, fuck you, let's go, and play some crazy music and put my headphones on and go. And whether that looks slow or half or what, I go. I rarely let myself sit in it because I'm full-fledged still in it. So I don't have time for that. You know, so that's what I do. A lot of my friends always say to me, you know, like, I don't know how you do it. I don't know how I do it. I just do. Like sometimes I just can't think about it all. So I know what I have to do and I got to do it. And whether it takes me 1 hour or 2 hours or, you know, half early and then half later, I just do. So it's probably not the best advice, but that's what works for me. That's what's kept me going every day and getting out of bed.
Renee, I think it's great advice. And I want to just point out that when I have Renee pull back in her program, it is very important that I make it clear that the reason I'm asking for a pullback has nothing to do with cancer and everything to do with the body requiring restorative time, downtime, no cardio, because we're going to use that as our little get out of jail card for free later down the road. And because when there would be times when I would say, no, I just want you to do this. I just think 5 days. She'd be like, no, like, do not treat me like that. And I'm like, oh, honestly, I'm not. I'm just being coach and saying, you know, I need your body to respond this way. So we're going to do this. It has nothing to do with it. So it's, you are a goer. And that's why I have to sometimes put the reins on you. And it has nothing to do with the cancer. It has everything to do with like, don't fuck up my plan because my plan is to do this. You're muted, Lexi.
Thank you. Did not realize that. I know we're coming up to 8:30 and I know that this is probably past a couple of your bedtime. So know that I really, really, really appreciate all four of you being on this call. To Magda and Janet and Deborah, I also appreciate you guys being on the call. And then everyone else that is watching live / made it to the end of this. Thank you. Thank you for creating space because cancer can be a heavy topic. And I'm sure that there's a lot of women that saw the auto message going out being like, tonight we're talking about cancer. They were like, I'm not going to attend that one. But you guys showed up and you were open and honest and vulnerable. And this is hands down one of my favorite Lady the FUp team chats that we have ever done. So again, thank you for your strength. Know that when you do not have the ability to be strong, you can lean on this community and we are here to support you in any and every way possible. All right. Have a great night, everyone. Thank you.
Thank you, everyone.
Thank you, everyone.
Good night.